You are watching the DocTalk show.
Welcome back. We are discussing family planning. Going to understand the types of methods that are available, some of the common side effects, and explain or demystify some of the myths that surround these family planning methods. So, Dr. Dennis, you're an expert in family planning. You've worked a lot with people. You've been involved in services providing family planning to people. Could you help us understand the types of the modern methods that are available?
Okay, thank you, Dr. Darius. So the methods of family planning can be divided into several categories. We have the natural methods or traditional. Mm-hmm. Then we have the modern methods. Under the modern, we have the short-term methods. Mm-hmm. We have the long-term methods. Mm-hmm. And then we have the permanent methods.
Okay.
So the short-term methods,
in this case, like a short duration of action.
Short duration
of
like short. Yes.
How long it can last?
Yes.
Okay, and that can go
up to 3 months.
Up to 3
protection
months.
Against pregnancy.
Against pregnancy up to 3 months. That is the short term.
Yes.
Then long term is longer than 3 months, up to say how many years?
Say 10 or 12 years.
Okay.
Yeah, at least as per the modern methods available.
Okay.
And then the permanent methods, as the name, they are permanent. They are irreversible.
Irreversible.
So what I have to say is that the short term and the long term are reversible. It means that you can use them for a desired period of time and discontinue the method and have your normal body functioning return.
I mean the fertility.
I mean the fertility. So a woman can be able to conceive right after discontinuing the method.
Okay. Yeah. So Dr. Inembabazi, what are the short-term methods that people can learn?
We have a number of short-term methods in the market, and I think most women or everyone has probably heard of the pills. We have two kinds of pills. We have those that have 2 hormones, and then we have those that have 1 hormone in them. Generally, for the pills, as you said, the short-term methods, the pill, for them to be effective, you actually have to take the pill every day.
Every day?
Yes. You have to.
Miss in a single day? Yeah,
you don't even have to miss a single day. If you do, you can take the pill immediately when you remember. But what you have to have at the back of your mind is that the more you miss, the higher the risk of you getting pregnant.
Okay.
Actually, yeah, that means you're not using the method correctly.
Okay, so to dive into those types of pills, you said there are 2 types of pills.
Yes.
One has 2 hormones.
Yes.
Those are what they call the combined oral contraceptives.
Yes, those are the oral combined contraceptives.
The second has 1 hormone. Those are the progestin one-day pills.
Yeah.
All right. So how effective are the combined oral contraceptives, the ones with 2 hormones in them? How effective are they?
If these pills are used correctly, if they're used correctly in the right way, these pills can actually have they're 99% effective.
99% effective?
Yes.
It means out of 100 people,
only 1 will get pregnant.
Just 1 will come back with a problem.
Yes. Combined oral contraceptive pills are actually protective when it comes to ovarian and endometrial cancer. They actually protect the woman and reduce her risk of getting those 2 kinds of cancers.
Dr. Chimoges, in your practice, I'm sure some women have come to you complaining of some side effects of these pills.
Yes.
Especially the ones which have 2 hormones.
Yes.
Could it, by the fact that it has 2 hormones, does it mean the side effects are more?
On the whole, the pills, be it the one which contains 1 hormone or the one which contains 2 hormones, they generally have similar side effects, and these side effects range from weight gain, sometimes weight loss. The women complain of headache, they may complain of dizziness, they may complain of nausea and vomiting sometimes. Some women also complain of reduced sex drive.
Okay.
Yes. Those are, then importantly, they may have a change in their menstrual cycle. So sometimes they may see spotting little blood, or they may get heavier bleeding, the days may increase, or the volume of blood could increase.
Because that's the effect of the hormone on the woman's cycle.
Yes,
it
because
changes the cycle and causes the periods to change.
Yes, because already the woman's body naturally produces these hormones. Now, when we introduce the hormones from outside, the immediate response of the uterus causes some instability in the hormonal levels. So it causes some kind of imbalance. Yeah.
So are there people who shouldn't be taking the combined pill?
So with the combined pills, there's a hormone called estrogen, which they contain. Now that hormone may cause undesirable effects in women who have certain medical conditions. For example, women who have clotting problems, or if you've been told that your blood easily clots, should not take combined oral pills, because that hormone might increase the risk of getting a clot. So if you're already predisposed.
Dr. Nimbabazi, could there be other medical conditions where we cannot give these combined pills?
Yeah, if someone has history of migraines or persistent headaches, these pills may actually worsen them. So if someone comes to you and they want to have these pills, you should screen on top. In addition to their history of blood clots, you can also ask if they have persistent attacks of headaches. And then the other thing to note between the two pills, if someone is breastfeeding, these combined oral contraceptives may actually have an effect, reduce the breast milk.
Oh, so they have an effect on breast.
Yeah, so we advise, if someone is breastfeeding, it would be advisable to be, if your choice of contraception that you've chosen is pills, it would be better to be on progestin only pill. So
the combined oral contraceptive is not suitable for breastfeeding mothers?
Yes.
Mothers who are doing exclusive breastfeeding. So if our guidelines recommend 6 months exclusive breastfeeding for infants. So if you are in the immediate post-delivery period, that is between birth and 6 months, we would advise them not to use a combined oral contraceptive pill because it may interfere with breast milk production.
Okay. Any other methods, like short-term methods that you should know about?
Yeah, and I think it's also quite popular, the injectable method.
The injectable method.
Yeah, it also has one hormone. One thing to note is that these methods, the modern methods, some are hormonal and some are non-hormonal. Okay. Yeah, some contain we'll see the ones that don't have hormones, but as we're still discussing these short-term methods, the pills and the injectables actually have hormones.
They have hormones.
Yes, but the injectable has one hormone. So what this means is basically the side effect profile and the way in which these methods work, how they are able to help a woman prevent pregnancy, is basically the same. The active agent is the same. So the active
agent in that case is the hormone.
Yes. Yes, yeah. So you still have women coming to you with complaints of weight gain, weight loss. You still have women coming to you with complaints of headaches, nausea. Yeah, and the injectables, currently what we have on market, the common one, can protect a woman for up to 3 months.
That seems to be very convenient, Dr. Chimunges. Have some women come to you liking the injectable?
Yeah, it's quite popular. It's quite popular because it's easy, it's fast, and it seems to be more readily available. Yeah.
And it eliminates the use of taking a pill daily.
Yes.
This one just given an injection.
And you can rest for 3 months.
For 3 months.
Yes. But you see that again depends on somebody's choices, because many women may want to rest even longer. So that's why when we shall be discussing the other methods which work even longer.
But if I give the injection today, immediately the person won't get pregnant? Dr. Ainembabazi?
Yeah, for some of these hormonal methods, actually, in contrast to the barrier methods, some of these hormonal methods actually don't start working immediately. That's why we advise our clients, our mothers who come to us, that for example, if you have the injectable, we advise you that please wait a week, abstain for a week, or if not, if you can use another method, or talk to your partner that this method that I've got is not going to start working immediately until a week has passed.
Until a week. So, Dr. Dennis, why 1 week? I thought it would be immediate.
So the hormonal methods, they need to build a certain amount of the drug in the blood so that it can send a signal. You see that the body is a computer, whereby
It's like a computer.
it's like a computer.
Yes.
So the brain orders the different body parts what to do. So in order for the brain's instructions, because the brain instructs the body every month to do certain things. Like for example, every woman undergoes her menstrual period every month, because the brain sends a signal to the uterus to prepare for a potential baby. So when the baby doesn't come, you pass the woman sees her periods. So now
So in other words, just saying the hormones are like signals.
yes,
They'll instruct the brain now, do not initiate.
So the hormones are like chemical messenger, or it's like a signal system which alters or which changes the brain's normal way of functioning to change the body to achieve a desired effect.
So it is changing the menstrual cycle in a way.
So it changes the whole more than just a menstrual cycle, the whole system, because one of the ways in which these drugs work is that they may block the release of the egg, or they may increase the mucus at the cervix, and that prevents fertilization. We expect that within a period of 7 days, we shall have achieved that concentration which is required to produce the
Okay, so we are understanding the different methods that are available for family planning. We've briefly looked at the short-term methods like the pills, which are two types, a combined pill or a progestin-only pill, and the use of the injectables. After the break, we shall understand more methods and demystify some of the myths that surround these family planning methods.
You are watching the DocTalk Show.